Members of the Senate Aging and Youth and Health and Human Services Committees, good morning, and thank you for this opportunity. I am Zach Schamberg. I am the President and CEO of the Pennsylvania Healthcare Association, better known as PHCA. We represent long-term care in Pennsylvania. That includes nursing homes, personal care homes, and assisted living communities. We represent the providers, we represent the workers, and most importantly, we represent the residents they serve. Today, I want to begin by looking back. At the start of the COVID-19 pandemic, one of the first calls that we made was to our counterparts in Washington State, where the virus first made its way to American soil. And as you'll recall, those initially affected were residents in a nursing home. When we asked what we needed to do here in Pennsylvania to prepare, to be ready, our friends there told us without hesitation that we needed to find more staff because the existing challenges that we faced, the existing shortages, would only be exacerbated and amplified by the virus. That was February 2020. A few months prior, Pennsylvania's then Auditor General crafted a report that was entitled, "Who Will Care for Mom and Dad?" What was supposed to be an in-depth analysis of the Department of Health's survey processes instead morphed into a focus on the lack of caregivers in this state because the problem was so apparent. That was August 2019. A few years earlier, Pennsylvania's legislature and governor granted nursing homes their last Medicaid reimbursement increase. As you'll recall, Medicaid pays for more than 70% of all care delivered in a nursing home. Even then, our members were advocating for higher reimbursement so that they could invest in their workforce. That was June 2014. My question today is, what has changed? What changed since 2014? Since the Auditor General's report was published? What changed since March 2020 when nursing homes became the epicenter of the COVID-19 pandemic? Because here we are today debating a proposed regulation that would effectively make Pennsylvania's nursing home staffing minimums the highest in the entire country. We've asked our members, your constituents, what's changed. And here's what they've told us. In just the past few months, open and unfilled positions have significantly increased, while qualified applicants have steadily decreased. Providers have lost, on average, nearly 20% of their workforce since last March. Nearly half of our membership has reported today that they can't meet staffing minimums. They're relying more and more on agency or contract staff. So things have changed here in Pennsylvania. It's gotten worse. And here's where it really impacts the constituents you serve. More than 80% of our members tell us today that they have been forced to limit new admissions due to lack of staff. In one of the oldest states in terms of population in the entire country, we have a very real access to care issue. That should alarm every single person in this room. Now, we've done the math. This regulation would require 7,000 new workers and at minimum $400 million in new costs. At PHCA, we've prided ourselves, I've prided myself on coming to you, the members of these committees, with solutions. Since your very first hearing last year during the pandemic, we want to help you find answers to our challenges. But today, I don't have answers. I just have questions on behalf of thousands of providers throughout the state. What steps will the Department of Health and the legislature take to help us build our workforce pipeline? Who will fund this new cost, given that providers pre-pandemic were operating at negative 2.4% margins? And where will our most vulnerable senior citizens go if the providers we represent are forced to stop accepting Medicaid or they close their doors altogether? Who will care for them? We said it in mid-July, and I'm going to say it again this morning. This proposal is unfounded, it's unfunded, it's unattainable, and it is out of touch with the reality that faces every single nursing home provider across this state. Thank you.